check this out. Has anyone heard of the blood-brain barrier? Okay, the blood-brain barrier, for those that haven't, it's your brain's protective mechanism. It prevents bad things in your bloodstream from crossing this barrier and getting to your brain. Because once you get toxins to your brain, you're pretty much screwed. You know, you're going to get neurodegenerative disorders, autism, things like that. So we can't have any of these toxins going to our brain. So the blood-brain barrier, what they found out is that it takes about roughly up to age 7 for our blood-brain barrier to mature. About age 7 is what a lot of texts say. Some say even to adolescence. But when you're looking at this, what happens is if you have heavy metals, like for what we show here, you know, we got the blood on the top, the brain on the bottom, in that barrier. Aluminum, lead, and mercury, you know, these actually can bind to amino acids and come through that immature blood-brain barrier. So it's very important then, you know, because the younger you are, the more permeable it is, meaning the more easily things can go across it. So if we know that the blood-brain barrier doesn't form till age 7, and some texts say adolescence, then it's common sense that you would do two things. You would limit your toxins and your heavy metals in your body, especially when you're younger, as much as possible, as well as you would want to keep your glutathione levels as high as possible. Because again, remember, even if you do have heavy metals in your bloodstream, that glutathione can bind to them and prevent them from actually going across the blood-brain barrier. With me on that so far? Okay. This is our vaccine schedule. Now, remember, your blood-brain barrier is not formed till you're 7 years old. So how many vaccines do we consume before 7 years old? Well, before age 6, we're consuming 49 doses. Now, let's just look at the vaccines we're taking at those ages, and I'll zoom in there. At 2 months, we're taking the DPT shot. DPT is diphtheria, tetanus, and pertussis. At 4 months, we take another dose of the DPT shot. At 6 months, yet another dose. 12 months, another dose. And between 2 and 6 years, you take another dose of DTaP vaccine. They either call it DTP or DTaP. But those couldn't possibly have heavy metals in there, right? Because our blood-brain barrier is not formed. Well, if you actually just go to the Center of Disease Control very own website, you will find exactly what's in this vaccine. And I did that, and I took a snapshot right here. I could go on a list about every single one of these, but let's talk about a few. The ones I circled here. Let's blow that up here. Aluminum. Okay, aluminum is 7 times more toxic to your brain than mercury. So people, the vaccine manufacturers, started taking out mercury, replacing it with aluminum. That's not a whole lot better. They're both potent neurotoxins. Neuro meaning nervous system, brain, toxins, poisonous. So you're consuming these toxic heavy metals into your bloodstream, going to your brain. Polysorbate 80. Polysorbate 80 makes your brain barrier yet more permeable. Formaldehyde. That's one of the most toxic substances ever. That's why aspartame is getting such a bad rap, which it should be, from diet sodas and stuff, because it converts to formaldehyde in your body and it can cross the blood-brain barrier. MRC5. Has anyone ever heard of that? This is on the CDC website. So what do? I look up MRC5, and I can't make this up. MRC5 cell line was developed from lung tissue taken from a 14-week fetus aborted for psychiatric reasons. So before we're age 7, we're consuming 5 doses of aborted human fetal cells. Freaking pisses me off, okay?
Right.
All right. So before we're age 7, we're taking 5 doses of this toxic heavy metal human fetal cell crap under our immature blood-brain barrier. Now, here's the kicker. What do doctors give little kids before they give them vaccines?
Candy.
They give them freaking Tylenol. Tylenol reduces your glutathione levels in your body. So, but you know why they do it? Because you might get a fever, you know, from the vaccines. You might feel a little sick. So we're just going to give you a little Tylenol before we do that so you can feel better. It's a freaking joke. And this is evidence-based. This is a freaking joke. And you wonder why we're so sick. This is crazy. And all autistic kids had low levels of glutathione. So if we know that, how in God's green earth can they give Tylenol before they give vaccines that actually deplete your glutathione levels, your only defense mechanism against these toxic heavy metals from reaching your brain? I mean, you can't make this stuff up. And so we look at this. The blue line's autism. The red line is vaccines. You increase the vaccines, you see a pretty high correlation with increased cases of autism. Now, side effects. Everyone knows what a side effect is, right? You know, they're known adverse reactions that can happen from a therapy. For example, a blood pressure lowering drug can cause dizziness, can cause headaches from less oxygen going to the brain. Just a known side effect. A side effect of statins is muscle pain, just a known side effect. Did you know that vaccines actually have a package insert with side effects on there? Did anyone know that? Has anyone ever read that?
No, because the doctors just give it.
Well, here it is. Yeah, here it is. CDC website, cdc.gov. So we look at this, and this is from the DTaP vaccine as well. Let me blow it up. Anaphylactic reaction, autism and SIDS. This is directly from their research. Now, you're seeing autism. They don't just put autism there. It's actually proved to actually happen, so they have to list it as a side effect. And this is in the vaccine insert, but no one talks about it. SIDS. I actually have a cousin that died from SIDS. And of course, the mom's a pediatrician. They blame everything but the vaccine. But tell me one other thing that kid is doing with a side effect that actually says SIDS on it. Nothing. In fact, they're taking, sleeping position classes. It's like, dude, do you think the babies in the hunter-gatherer population had to take sleeping position classes? I mean, it's a freaking joke. You can't sleep on your stomach? I mean, come on now. This is crazy. So it literally says SIDS on there. Now, they actually did a study in the Journal of Human and Experimental Toxicology. The more vaccines given, the greater amount of SIDS. It's crazy. You know what SIDS is? Sudden infant death syndrome. When babies go to sleep, they never wake up. So I just like this little quote here. If you mixed mercury, aluminum phosphate, aluminum sulfate, and formaldehyde with viruses, then got a syringe and injected it into your child, you would be arrested and sent to jail for child endangerment and abuse. Then why is it legal for a doctor to do it? And why the hell would you let them? It's crazy. You got to educate yourselves. Now, here's the thing. We've all heard this excuse. Oh, I was fully vaccinated and I'm fine, right? And personally, I was fully vaccinated and I am fine. But not every single kid out there has enough glutathione levels, and not a lot of them out there are so lucky. I happen to have enough glutathione in my body to protect myself from those heavy metals getting into my brain. Some kids aren't so lucky. And so when you're looking at the autism just prevalence right now, does anyone know what this growth is called? It's called exponential growth. Now, it starts off in 1975 when it was 1 in 5,000. This graph ends in 2009 where it's 1 in 110. Anyone know what it is now? It's 1 in 45. So just in a 6-year period, it went from 1 in 110 to 1 in 45. If this projection stays true, and there's honestly no reason why this wouldn't, because we're still consuming copious amounts of vaccines. In fact, now they're being pushed on us mandatory to get in schools, and we're consuming tons of GMOs, glyphosate. There's no reason why this trend's not going to continue. But if it does, 1 out of every 2 children is going to have autism by 2025. I mean, in 2009, they thought it couldn't possibly get any worse. But now it's 1 in 45 instead of 1 in 110. Has anyone seen a child with autism? It is absolutely devastating. But it's not just vaccines, because it definitely is one of the huge contributors. But you also got to look at glyphosate and GMOs. This shows the prevalence of autism here, and that red line is the amount of glyphosate added to our food. So you see a pretty strong correlation there as well.